I want to talk about a new White House report now that points out what it says are 4 drivers of chronic disease for children. And we went through it for you. The report, commissioned under Health Secretary Robert F. Kennedy Jr., blames poor diet, aggregation of environmental chemicals, a lack of physical activity and chronic stress, as well as what they describe as over-medicalization. And we've got the right person to explain this for us here with us now. Dr. Celine Gounder is a CBS News medical contributor and, of course, the editor-at-large for public health at KFF. Dr. Gounder, thanks for being with us. This report really paints a stark picture. What do they say is really driving this chronic rise in childhood illness?
So the 4 factors that they point to are ultra-processed food, environmental chemical exposures, lack of physical activity, and then finally this over-medicalization of children. And what's really interesting here is if you align what MAHA is saying, the MAHA Commission is saying, with the big, bold, beautiful bill that was just passed in the House, there's a real disconnect there. Because if you take each of those things and what the solutions would be, many of the programs that would help address those are being eliminated or defunded right now.
That's right. We're talking about SNAP. We're talking about getting people lower on the socioeconomic scale access to food. What then would be other solutions to these things? Well,
you take them one by one. So, for example, ultra-processed food. Under the Biden administration, they drafted front-of-package food labeling guidelines to make it really clear to people high in salt, sugar, fat. That guidance has not yet been finalized by the FDA, and we don't know if the current administration will move forward on that. But that would be one kind of measure. You mentioned SNAP. Making it easier for people to access healthy food, which really does come down to how do you promote farmers producing more healthy food? How do you regulate food to reduce some of the additives in the food? Let's take environmental toxins. You also had the EPA Administrator Lee Zeldin who said, we don't want more regulations. Well, how else are you going to reduce your exposure to toxins in the environment? So there's a real disconnect between what they're identifying as the problems, but not really wanting to entertain what would be the logical solutions.
And then we also have to acknowledge how people are receiving this information. Sometimes people are trusting of the government, sometimes they're suspicious. So in general, based on what you've just laid out, what is the position of the government when it comes to the health of people and especially young people?
That is a great question, and I think there are different perspectives within this government, whether it is President Trump himself, Secretary Kennedy, you have some of his various agency heads. I think everybody has slightly different perspectives, which is also why you're getting a bit of a muddled message. And then you have Congress, and it's really up to Congress to decide to fund certain programs, and a lot has been cut at the CDC, which is our big public health agency. And it seems from the proposed budget coming out of the administration, we'll see what Congress does with that, that there are going to be more significant cuts to come.
At the very least, folks should look into this report. Information is, of course, always crucial. And we appreciate you being here to kind of clear it up a bit. Dr. Gounder, thank you so much.